This solution is used to manage excessive sweating. This medication is only meant to be used on the skin. Make sure the area is dry before applying the medication. If necessary, you can use a hair dryer on the warm setting to dry the area for a few minutes. Follow all the instructions in the product package. If anything is unclear, talk to your doctor or pharmacist. Avoid getting the medication in your eyes or on broken, irritated, or recently shaved skin. If it does get on those areas, rinse with plenty of water. Use a thin layer of this medication on the affected area as directed by your doctor, usually once daily at bedtime for 2 to 3 days until the sweating is under control, then once or twice a week afterwards. Let the medication dry after applying it. If using on the hands or feet, wrap the area with plastic wrap and cover with a mitten or sock. If using on the underarms, wear a shirt. If using on the scalp, wear a plastic shower cap. Leave the medication on for 6 to 8 hours. In the morning, wash the area with soap or shampoo if treating the scalp, and water, then towel dry. Do not use other antiperspirants or deodorants while using this medication. Talk to your doctor if your condition persists or worsens. When you first use Drysol solution, non-dash, you may experience some tingling, mild itching, or irritation. If these symptoms persist or worsen, it's important to let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it is rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before using Drysol solution, non-dash, make sure to let your doctor or pharmacist know if you have any allergies. This product may contain ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to let your doctor or pharmacist know about your medical history before using this medication. Keep in mind that this medication may stain clothing, fabrics, or metals, so use it cautiously to avoid any contact with these materials. Make sure the medication is completely dry before putting on any clothing over the treated area. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using this medication if you are breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Drysol solution, include deodorants, other antiperspirants, disulfiram, metronidazole, tinidazole. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with anyone else. If you forget to use Drysol solution, at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Don't take a double dose to make up for the missed one. This product should be stored at room temperature and kept away from heat. It should not be used near an open flame, and the container should be kept tightly closed. Make sure to keep all medications out of reach of children and pets. Do not flush this product down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.